This portion of CardioSource video news coverage of AHA 2010 is brought to you by Novartis Pharmaceuticals Incorporated.
Well, I'm here with Professor Murray Esler from Melbourne, Australia, who will talk to us about fascinating results of a new procedure for treating hypertension. Let me begin with some of the background of the concept of renal denervation that you've been studying for many years.
That's right. We've developed a technique based on many years of research in humans that shows that the sympathetic nerves to the kidney are usually activated in hypertension, and parallel research showed that cutting those nerves surgically in animal models of hypertension usually made the hypertension go away. So that was the backdrop to developing a radiofrequency catheter to ablate these nerves in resistant hypertension.
Wow, well, it's a fascinating thing, and certainly ablation has been a big advance in atrial fibrillation. Now, how did you apply this now for hypertension? Are there certain patients you aim for?
That's right. We've just completed a randomized controlled trial in treatment-resistant hypertension. They had to have systolics above 160 and be on 3 or more antihypertensive drugs, and so we recruited patients like that to do a controlled study, randomized 52 into a denervation group and a parallel group of 54 who just continued on their medication, which on average was 5 drugs.
Wow. And so what did you find?
Well, it worked out according to plan, or better than plan. The blood pressure fall on average was 32 on 12 in the denervated group, and the control group, the blood pressure didn't change. It was a 0 change.
Wow. And so there, so it would be, say, an average of, it has to be over 160. What kind of blood pressures?
The entry blood pressure on average was 178 in these people, so they started very severe. That sort of reduction meant that 39% of them ended with a systolic under 140, 85% had 10 millimeters or more fall.
Wow. And this procedure went safely and was able to be done without complications?
Yeah, there's no such thing as a free lunch, but it came pretty close. We were particularly cognizant of the fact we could get acute vascular complications. There were none. There were no thromboses or other complications. And then at 6-month follow-up, renal artery imaging showed no stenoses or no aneurysms. So the procedure actually turned out to be very, very safe.
Terrific. So what would be next in terms of developing this as something that could be used in practice?
Yes, the device is now cleared for clinical use in Europe and Australia, where most of the work was done. The next step for us is to do a pivotal USA study, and we're talking to the FDA at the moment about designing that, and the projection is that study will commence early in 2011 with a view to gaining regulatory approval.
This is very exciting. Congratulations. A wonderful advance into an area where we thought we'd know how to treat hypertension, and really looked like a spectacular result. So congratulations. And from the American Heart Association, I'm Chris Cannon with CardioSource Video News.
Special thanks to Novartis Pharmaceuticals Incorporated for supporting continuing coverage of CardioSource Video News at AHA 2010.